Hi, I thought I'll reflect on two of my patients this morning, as I'm quite enjoying these reflective videos that I'm doing talking about case studies. These two patients, I think, highlight the importance of taking a good history and asking patients the right questions. So the first one, first patient of mine who I've seen a few times, plays a lot of football, tends to roll his ankles in slightly, not a major problem, but his big toe does rotate in slightly, which means that he does damage the inside of his nail. It gets quite thick, and I drill it down on a regular basis. He went to see his doctor, before he came to see me rather, he went to see his doctor. He thought he had a fungal infection. The doctor really didn't look at his nails at all, and prescribed him terbinafine, which is a very powerful drug that you take. It's a tablet. It can be quite harsh on the liver. Also has other side effects that are not pleasant, such as changing the taste of food, can cause major stomach upsets. It turned out he never had a fungal nail infection because they didn't do the right test. So the GP should have done a test first before he prescribed this, and as he didn't, he took these tablets. Later on, when they did do the test, it came back to be negative. Then another GP saw him and thought he had a melanoma under the nail, which is a type of skin cancer or nail cancer in this case. He never had that either, but 3 different GPs saw it and they sent him to a dermatologist. What nobody asked him in this entire process was about his activity. Nobody saw him standing. Nobody asked him what sports he plays. It would have been quite obvious that the way that the nail crumbled and the damage to the nail, it wasn't a melanoma. So after going to a dermatologist, he came back to say it wasn't a melanoma, thank God. He was relieved, as he's just had a child, and it would have been the worst news ever. So the interesting thing about this case was asking the right questions and doing the right tests at the right time. Ideally, the doctor should have done a fungal test first before he gave such a powerful drug, and he shouldn't. And because it was 3 other doctors that said that he may have had a melanoma, they shouldn't have scared the living daylights out of him for months on end, because then he went onto Google and thought his foot would have to be chopped off, so he got quite drastic. So before they told him that, they should have asked him a few more questions, and just the type of nail damage it would have been, and the type of discoloration, it would have been obvious that it wasn't a melanoma. The second case, which is the complete opposite, but I'm not ruling something out this time, I'm ruling something in. So I've had a patient a 15-year-old, loves to play cricket, a really good fast bowler, has lower back pain. Now, he's been to see a few physios. Somebody suggested that maybe your feet are pronating in. Again, that word that I really hate, overpronation. Sorry, I have to have my coffees. I have so many coffees during the day, like 6 or 7 coffees just to keep myself going, but that's another story for a different time. Back to this patient. So 15-year-old, loves to play cricket, really fast bowler, has lower back pain. Saw a couple of physios, then saw somebody else who said, you may have flat feet, why don't you go to a podiatrist? Has been to see me, and I started to ask other questions, like, do you have any pain in like any other joints? And it turns out that he had joint pain in a few different joints around the body, not just the lower back. He's also lost a little bit of weight recently, quite tired, constantly tired. Mom and dad thinks that he's playing up, but he's adamant he's really tired. Now in this case, I was a bit concerned, so I have sent him on for further investigation with the GP. I wrote the GP a letter. I suspect it could be a type of inflammatory arthritis. which can happen in teenage boys. The interesting thing about this case was nobody asked these questions. They just went straight to the back. He's got lower back pain. He must have tight hamstrings, or he must have something else, or maybe his bowling action needs to be changed. But some of the basic questions were never asked. To be fair, I'm always reflecting on my practice, even though I've been doing this since too long now, 20 odd years. I have changed a lot. So the questions that I ask have changed, and the way I assess, especially sporty kids, and the language I use has changed a lot. But these two cases that I've seen are not atypical. So I do get patients that have usually been around the block, and they've been around to physios, chiropractors, osteopaths, and then somebody says, why don't you see a podiatrist? And then they get recommended to come to myself. Things get missed, and often negative patterns get placed by different people because of the language that they have used. Anyway, I thought I'd share that. My next patient is due in 10 minutes, so better finish off my coffee and get ready. Take care.